with juveniles. The earlier we help someone that has an issue and a problem, the more effective we're going to be. But we don't do that. We wait till the problem has been exacerbated. They've been in and out of prison 5 times. We know that that doesn't work. And it's just now we need to be a lot smarter.
Tom Oak is the co-founder and former chief executive officer of Disc Village, one of the largest and most comprehensive prevention, intervention, and treatment agencies in Florida, providing services to more than 10,000 individuals and families each year. Mr. Oak served as founding president of the Florida Juvenile Justice Association, founding board member of the Certification Board of Addiction Professionals of Florida, and is board member and past president of the Florida Alcohol and Drug Abuse Association.
I've been in Tallahassee for a long time, almost 50 years in treatment business, and, from government to the entire strata, and I think people would be amazed at the number of people in recovery. My first job when I graduated from Florida State University, I was in the School of Social Work, criminology, and my first job, the state of Florida had just taken over the juvenile justice system. At that time in 1971, it was actually run by the counties. And so when the counties were running, you can imagine, and we have 67 counties in Florida, so we had 67 different ways of dealing with youth. Not a lot of it was pretty. And so the state intervened and said, look, we're gonna consolidate all this and take over. So I was actually one of the first, they call them youth counselors, one of the first youth counselors that actually worked with juvenile delinquents. I started in 1971. And after a very short period of time, I realized that without exception, probably at the time, because I was shocked at this, that the amount of substance abuse for young delinquents was it was astronomical, and I was shocked. Now I went to FSU, we had Vietnam, we had protests, we had drugs. I mean, I guess that's when all of it started. But I was shocked at the just how broad it was in that community, and the community was upset about it. And in fact, a group of us got together and wrote a grant, and for the first time, and I guess it was 71, 72, when federal money began to flow, the state actually says, hey, there may be a problem here. I mean, unfortunately, we usually don't deal with a problem until it reaches crisis proportion, and it was beginning to reach that level, and we put a proposal together, and we started a walk-in center in St. Augustine, and that was in 1972 when it finally opened. From there, Dr. Alexander Basson, who I'll go into later when you want to talk about the history, he was one of the founders of the entire system. He was a professor of criminology at Florida State University. He was putting a grant together. They called it Town and Gown. And FSU was the prime sponsor, and what they were trying to do, because it was a brand new field, is actually set up a system where they began to train counselors. And because I had started a program, I had familiarity with the criminal justice system. I actually was hired by FSU, and we set up DISC House, and that stood for Drug Information and Service Center, which was the first one affiliated with a major university to actually train people in the field, because there wasn't anyone working in the field. It's like, what do we do with this? So that was the beginning of how do we deal with the problem? What do we put in place? And at that time, most of the services for substance abuse was actually residential. In fact, it was based on what they call therapeutic community model, which actually began, if you go back to the 50s, if you had an addiction problem, whether it was alcohol or drugs, it was a terminal condition. And there's a group in California, they started Synanon. And there was a man who wrote a book called The Tunnel Back, and I think his name was Carl Yablonsky. So if anyone's interested in learning the history, and that was a group of recovering addicts working with other addicts. But at that time, their philosophy was this is a lifelong addiction, and if you're in treatment, you never leave. So then I mentioned Dr. Alexander Basson. He was actually the chief psychologist for New York City at the time. He journeyed to California and got one of their counselors, his name was Dave Deitch, and brought him back to New York, and they actually started what they at that time called Daytop Lodge. Now, if you fast forward, let's say 20, 30 years, Daytop was a group of programs that was nationwide at one time, and that was part of the beginning of the revolution and drug treatment. Out of that sprang Gateway in Florida. It was Concept House in Miami, PAR in Pinellas County. And that was really the beginning. And then in Tallahassee, we had some additional dollars that arrived, and we actually started a residential program at that time as well. So now we had a laboratory. So that's how I got in the business. And since then, it's more or less, it's been a calling. I've never seen it as a job. It's something that I have passion for. If you look at how we treated people in the judicial system, 40, 50 years ago, we pretty much treat them the same way now. That was the purpose of what we're doing with PTAC, and I think what our organization did 20 years ago with juveniles, we began a program that was a pre-arrest, where you don't have to arrest someone, you don't have to label that person for the rest of their life. Now think about that. Anyone that's arrested, you're labeled for the rest of your life. A lot of people say you can have your record expunged, but it's a very difficult process, a very costly process, and I'm not sure it's totally expunged. There are exceptions, of course. And it's proven if you go to the Department of Juvenile Justice website, you see that they've collected a massive amount of data. It's probably one of the most cost-effective programs. And the secret is you intervene early. You try to deal with the child holistically, their family, not just with addiction issues, but with all criminal issues. So now you're actually, if you think about how do you solve a problem, usually we deal with the back end of the problem when everything's a crisis, like I brought up before. But unless we get ahead of it, and when a child and a family has an issue and a problem, if we don't deal with it in a responsible way, provide the appropriate array of services in a timely manner, and have the family involved, it's faster, better, cheaper, and longer lasting. So that's something that I think that everyone misses that boat. It's one of my pet peeves with everything I do, is that if we're going to develop a comprehensive system, we have to start in the schools. And our agency currently now is in over 50 schools, where we begin to identify people with all types of problems, and not just addiction. That's one of the problems you have, is that we have what we call categorical funding. Instead of dealing with people that are beginning to have some issues, they have to fit a specific category. So we still do, categorical funding. We still fund silos. We even fund, you only can deal with a person that has this drug problem. They may have this drug problem, but that funding doesn't cover it, so sorry, it doesn't apply. So we call that the color of money. And at some point in time, we need to recognize we need to deal with addiction, regardless of the drug. I call it disease and crime du jour. If you go back 40 years, heroin, barbiturates, it's on and on and on. Every 3 or 4 years is a new drug. Each one allegedly is more dangerous than the other. Each one is incurable. That's the history. But guess what? They're not incurable. When someone has a problem, what do we do with them? We arrest them. We put them in jail. Is that really the best solution? Now, if they're a threat to society, now let me be very clear here, because I think unrealistic. If someone is a threat to society, they're violent, and they need to be someplace else. But if we do an assessment, which we should do on everyone, which we don't do, and if they're amenable for services, they're motivated for services, then why aren't we providing them? Why are we locking them up where we know that what good will come of that? We have probably a 300-year history of what happens with people that we lock up. The results are not good, and then we wonder why. For example, we have a large pre- and postpartum program for women and their children. Why would we have a pregnant woman in jail who's not a threat to society, who doesn't qualify for certain health benefits, being in jail, and it costs counties and cities millions and millions of dollars every year when they're in treatment, and of course they qualify for Medicaid? Why aren't we doing that? And it should be a standard. There's not a comprehensive approach in every state on how we deal with these things. There are pockets, there are some outstanding programs, there are some outstanding communities that are dealing with these things. But if you think about it, it costs money, and there has to be someone in charge, and I think that's what PTAC is trying to do now. We're trying to say, you know what? We don't have to arrest everybody if they're not a threat to society. And think about what we do. We arrest them. We give them a record that will follow them for the rest of their life. We basically, become a marginalized citizen. And then you think about how many people we arrest for low-level, nonviolent misdemeanors. Now, we just impacted on their life. Tallahassee is a good example. We started an adult pre-arrest program. So you arrest a couple thousand people a year. The base population there is about 225, 230,000. 2,000 or 3,000 people a year. That adds up after a while. So now all these people are not maximizing where they can be in a community. And how do you actually improve a community? How do you make a community better? Well, the first thing you do is you don't harm your citizens. You want to do everything you can to make sure they're productive, contributing members of society. That's what we need to do. We don't need to label them forever. But if you look at the harm that we do, the cost, they're going to pay less taxes. They're not going to reach their maximum. So you can't design one more harmful. There's a federal study done on it's called the Ferguson Report. Anyone can go on the internet and look at that. It was an entire city based on basically turning everyone into indentured servants to pay taxes and to pay fines and fees. You can be in a situation now because of your arrest. You lose your driver's license, you lose your job, they pack on more fees. You're in a hole for the rest of your life and you can't dig out of it. At some point in time, we've got to address things in a common sense way. We just can't keep packing on, here's another fine, here's another trust fund you have to support, all these other things. Last week, the Florida Senate brought in the public defender, a prosecutor, and the clerks of the court. And they looked at this problem. And the clerks were, I think there's over 100 different categories of fines and fees that they have to pay. The state of Florida collected something like $788 million in fees. So I think we need to take a look at all these things and say, look, let's take a common sense approach and figure out the best way to do this. I'm not saying that people that break the law don't have a responsibility to pay restitution. I think that should be the first thing they do. If we're going to tack on so many fees and penalties where they can't buy food, they can't raise a family, then I think we've gone too far. And I think we have, and I think that's something we need to look at, and I think they are. So we are making headway. I don't want to sound negative, but it's a long, hard road. But I think people have to realize it's been like this for 50 years. And so we keep making the same mistake over and over. When do we begin to say, look, let's make some changes? The state of Florida passed Senate Bill 1392, which basically makes it a requirement for every jurisdiction in Florida or every circuit to set up a pre-arrest diversion program for low-level misdemeanors. Now that's historical, which means you don't have to arrest them. We provide services, you do assessments. That can be a turning point. And the other thing it does is that it provides law enforcement another tool. Right now you have two tools. You can arrest or not to arrest for a low-level offense. Not arresting someone, I think, may send the wrong message. Arresting them, you've heard my comments on that, is not necessarily good for an offense that's really can be done a different way. But now you have a civil citation, which provides an assessment, intervention, accountability, community service hours, restorative justice principles are built in there, counseling, public safety is a key issue, and you have a higher success rate and lower cost. I mean, what's wrong with that picture? So I think that's what PTAC is trying to do, to say, look, there are different ways of doing this. There are better ways of doing this. We just all need to get on the same sheet of music. And there are so many people and facets involved in this. You've got state attorneys, public defenders. I mentioned the clerks of the court. You've got bondsmen. I met with a group of them, and they think, or told me that they think that, rehab's a waste of time, and that, if someone gets arrested for a low-level misdemeanor, then, they'll make $100 on it, it'll be $1,000, and everybody's better off. Well, obviously I disagree with that, but those are all the things you have to, those are the battles that we're trying to fight now, is say, look, let's put this all on the table, let's look at it, let's, as a responsible people who are running this country, running the criminal justice system, wasting billions and billions of dollars. We're at what's called the zero intercept. When you look at the 5 pathways that are listed on our website as far as how you intervene with people's lives, by intervening before they're arrested is really, from my perspective, probably the best way to go. Like I said earlier with juveniles, the earlier we help someone that has an issue and a problem, the more effective we're going to be. But we don't do that. We wait till the problem has been exacerbated. They've been in and out of prison 5 times. We know that doesn't work. And it's just, now we need to be a lot smarter and target this and have everyone on the same sheet of music. Really, that's kind of where we're at. And I think after 50 years, it's time for that effort.